Welcome back to the Delaware Way. I'm Larry Menti. The kidney transplant program with Christiana Care is now celebrating its 10-year anniversary. Here to talk about that is Dr. John Swanson and Dr. Stephanie Gilbert of Christiana Care Health System. Thank you both for being here. Why is this such a big deal? There's kidney transplant programs in Baltimore. There's kidney transplant programs in Philadelphia. Why is it important to have a program here?
As a Delaware native and working in Delaware, I know there's almost 1,300 people in kidney failure on dialysis in our state. Previously, they would have to travel an hour north, an hour south, when they feel ill, when they're going to dialysis, to attend these transplant programs. To have one locally, to have it in your backyard, is an immense benefit to them because most of the transplants may happen in the middle of the night, and all the subsequent care for months and years to come will be close to home.
And the drive isn't that bad though, right? Or am I underplaying this?
Well, when you're thinking about a person on, for us it's not much of a drive. It's an afternoon, but for somebody on dialysis, somebody who has to, is not feeling well, these are long distances. And the follow-up is very intense after transplantation. So patients want it to be close to home. I'm from a small state, if you will, called South Dakota. It's very large in area, but it's very small in population. And I know that back there, when I came here the first time 10 years ago, that people in a small state want to be self-sustaining. They want to be close to home. They want to know that it's right there in their backyard. So when people first challenged me to come, when I came here and said, well, you got Philadelphia and you got Baltimore, how are you going to make a program? I said, I know small state people. They want to take care of themselves and they want to be home.
A donor, I think, would normally be somebody that knows, if it's a living donor, it's somebody that would know the person that needs a kidney, right?
Correct. It does not have to be a family relative. It could be a Good Samaritan, could be a coworker. It does not have to be a genetic relation.
Are there Good Samaritans?
Yes, we've had several.
Because I mean, look, I'll be really honest. I'd have a difficult time being open up to give a kidney to someone I didn't know.
Well, I'm sorry.
In some of the altruistic donors, that's what we call them, cases, it's that they know they wish to donate and they know that why wait until after I have died? They want to see the benefit. They don't know the recipients, but they know it's something that they can do. They know that you can live your life healthy with just one kidney if you donate, and they know it will impact that person's life dramatically.
Let's talk about your two roles very quickly. You're the surgeon.
I'm the surgical director. I have a very qualified partner, my friend and colleague, Dr. Velma Scandalberry. We are the two adult transplant surgeons in the state of Delaware, and we provide surgical services for the transplant itself, for patients with end-stage renal disease, because we know their special needs, and we also are very prominent in managing the immune suppression or the drugs that protect against rejection.
And you like to say you do everything else.
I do the medical side. People always ask me, what is my role if I don't put the kidney in? And I always tease and say, well, it's everything else in terms of education of patient, which the surgeons share in, but in terms of maintenance of health. My partner, Dr. Helen Chang de Guzman, and myself are nephrologists, medical doctors who take care of kidneys, but we also specialize in kidney transplantation. And there's a unique set of medical conditions that can occur around the time of transplant and after that need to be managed.
I would imagine that there's people in the state of Delaware that either would be interested in being a donor or may need your help. How do they get a hold of you?
Well, we have a website on the Christiana Care website itself. We have, and you always can call 302-623-3866, which is our direct phone number, and that gets a hold of anyone in the transplant program.
Well, thank you, Doctor, I thank you very much. Dr. John Swanson, Dr. Stephanie Gilbert of Christiana Care Health System, saving lives in Delaware. That wraps up the Delaware Way for this week. I'm Larry Menti. Stick around now for another thing.